Well, there were several developments in 2021 regarding the COVID-19 vaccine. 41 NBC's Ariel Schiller looks back on what COVID vaccine distribution looked like across Middle Georgia in 2021.
The long-awaited COVID vaccine arrived in Georgia in December of 2020. Now, a year later, more than 50% of Georgians are fully vaccinated. In December of 2020, the FDA issued emergency use authorizations for the 2-dose Pfizer and Moderna COVID vaccines. Healthcare workers, those with increased risk for severe illness from COVID-19, and people living and working in long-term care facilities were the first eligible for the vaccine. In February, the FDA issued an emergency use authorization for the 1-dose Johnson & Johnson vaccine. Georgia then opened 4 mass vaccination sites that same month, including one in Macon. The drive-through style sites administered the Pfizer vaccine. Governor Brian Kemp visited the site set up in Macon at the State Farmers Market several days before it opened.
Our goal is to make sure that as we have supply, that we vaccinate every single Georgian that wants the vaccine as quickly as possible.
Vaccine eligibility expanded twice in March, first with people over the age of 55 and people with disabilities and certain medical conditions. By the end of March, all Georgians over the age of 16 could get a COVID vaccine. Don Ross, Chief Clinical Informatics Officer with Atrium Health Navicent, told us back in March the side effects for the vaccine are commonly confused with how your body is supposed to react.
I understand being nervous. It seems very new, but the vaccine is well tested. Millions of people have received it now, and it's studied, it's safe, and you should get one.
At the end of April, the state mass vaccination sites began administering the 1-dose Johnson & Johnson vaccine and the 2nd dose of the Pfizer vaccine to coincide with closing the sites. Then on May 21st, the 8 state-run mass vaccination sites closed for good. Site manager for the Macon mass vaccination site, Carrie Futch, said they administered more than 53,700 vaccine doses.
We was able to come in and provide the vaccines and do a pretty good push. Now there's vaccines available at pretty much any place you can go.
For months, Pfizer was and still is the only vaccine available to anyone over the age of 16. In May, the FDA authorized an emergency use for the Pfizer vaccine for kids ages 12 to 15. By the end of October, the FDA authorized another emergency use for the Pfizer vaccine for kids ages 5 and up. And nearly 3 weeks later, Michael Hawkinson, Public Information Officer with the North Central Health District, told us about 500 kids ages 5 to 9 received at least 1 dose of the Pfizer vaccine in the areas they serve. Also, about 7,000 kids ages 10 to 14 had received theirs.
We're not seeing huge increases in vaccination rates within our 13-county district. That particular age group is still lesser than the state average.
On December 15th, I looked at the most recent COVID vaccination data for kids in those age groups. Nearly 1,500 kids ages 5 to 9 got at least 1 dose of the COVID vaccine, while nearly 8,000 kids ages 10 to 14 got theirs. Reporting in studio, Ariel Schiller, 41 NBC News.
And to find out where you can get a COVID vaccine, go to vaccinefinder.org.